Okay, so now we're going to talk about rheumatoid arthritis, which is very different from osteoarthritis. Rheumatoid arthritis is a systemic inflammatory disease, and the joints are usually the most affected. However, the inflammation from rheumatoid arthritis can also affect organs and other areas of the body too. Okay? So rheumatoid arthritis is a systemic inflammatory disease. Rheumatoid arthritis usually affects joints symmetrically on both sides equally. So it may initially begin in a couple of joints only, and most frequently it attacks the wrists, the hands, the elbows, the shoulders, the knees, and the ankle. So the thing to consider about this is that one factor that separates rheumatoid arthritis from osteoarthritis is this bilateral disease process. Okay? So it happens on both sides. Rheumatoid arthritis is a disease that waxes and wanes. This means it comes and it goes. And when you have an exacerbation, this can result in the joint becoming red, swollen, painful, and very tender. And what's happening during an exacerbation are that there are circulating antibodies that are actually attacking the healthy tissues. In rheumatoid arthritis, the synovial membrane becomes inflamed, and it results in the production of excessive synovial fluid. So this is another differentiation. In osteoarthritis, we do not have an excess of synovial fluid. This is pretty much consistent with the rheumatoid arthritis. So synovitis is what we refer to when the synovial membrane becomes thickened and inflamed. So here we can see a picture showing us a normal knee joint. We look at the osteoarthritis knee joint, and what we see are the two ends of the bone rubbing together because of our worn cartilage. And then in the next picture, we can see the rheumatoid arthritis. We can see the swollen, inflamed synovial membrane. There's excess synovial fluid, and there's actually some erosion of the bone. Okay, so we talked about rheumatoid arthritis affecting more than just the joints. And in Sjogren's syndrome, there's inflammation of the glands of the eyes and mouth, and this can cause dryness of these areas. So this is an example of some organ involvement. There may be inflammation of the lung lining. We refer to this as pleuritis. It can cause chest pain with deep breathing or coughing. The tissue inflammation surrounding the heart is called pericarditis. And there can also be a reduction in the number of red blood cells. So anemia can result, or a reduction of white blood cells, in which case our patient may be immunocompromised. So how do we diagnose rheumatoid arthritis? Well, one of the things we can test for is rheumatoid factor. Rheumatoid factor is a blood antibody that is found in nearly 80% of patients with rheumatoid arthritis. We can also do a lab referred to as an erythrocyte sedimentation rate, or a SED rate. So here we have a tube of blood. And what happens is over time, the cells of the blood will settle, separating from the serum. Okay? So now we see the serum on top, and our blood cells have settled on the bottom. So an inflammatory process results in high fibrinogen in the blood, causing red blood cells to stick to each other. Any inflammatory process causes the red cells to form stacks, okay? And these are going to settle faster. So the faster they settle in the test tube, the higher the SED rate. So a normal SED rate is about 3 to 20 millimeters per hour. Women may have a slightly faster SED rate than men. Old folks may have a slightly faster SED rate than the young. Arthrocentesis is a procedure where a needle is used to drain the synovial fluid. This can be helpful in relieving the pain of a joint effusion. A joint effusion is defined as excess synovial fluid in the joint space. The other advantage of arthrocentesis is that analysis of the joint fluid can be diagnostic, so it can exclude other causes of arthritis. Maybe there's an infection going on, and when we aspirate some of that joint fluid, we can see that there's a microbe growing. Or gout could be another problem that's causing the problems in the joint, and in this case, maybe we would find uric acid crystals. And we're going to talk a little bit about gout in a later lecture. So pharmacologic treatment of rheumatoid arthritis is somewhat similar to that of osteoarthritis. NSAIDs can be used, again, ibuprofen, Tylenol, aspirin, corticosteroids may come into play. But rheumatoid arthritis also has other drugs referred to as immune modulating drugs. Methotrexate is an example of one of these. Tumor necrosis factor. And what these do is interfere with certain areas of inflammatory responses. So, for example, the T cell blocking agent works at that level. The B cell depleting agent works at that level. The interleukin antagonists work at the level of the interleukins. And all these basically help suppress the body's immune system from causing these antibodies to attack this healthy tissue. Okay, so that is our lecture covering the different types of arthritis today, and we're going to talk a little bit more about musculoskeletal disorders in the next lecture.